you said something interesting to me earlier about the approachability of this technology. What exactly did you mean by that?
So I think like the ultrasound machines are often looked at by these novice users, and they'll look at the screen and be like, ooh, that's pretty, right? That looks nice. These are like quality pictures, like ones that I've seen in a textbook, because their prior interactions with ultrasound are often when they're using the machine and their pictures don't look like that, right? So they see the nice pictures and then they're excited. And then they look down at the user interface or the keyboard or whatever, and they're like, uh-oh. And there's generally like a correlation between how nice the picture looks on the screen and how much uh-oh there is when they look at the user interface, right? Because the higher end machines tend to have a more complicated user interface. And so I think Kosmos's user interface is like the association between this is a really great looking picture and this is a like simple user interface. Like they get that, like it's there. And I don't think that's not the case. Like there's an inverse relationship between quality of the image and simplicity of the user interface. And so the user interface with Kosmos, it's pretty like, I don't ever have to explain how to do something to anybody. Like I might tell them where the thing is, but once they touch it, it's like self-evident how you control it. Like for instance, on some cart-based systems, something as simple as depth, which is the first thing you're going to adjust. It'll be like, instead of a button, it'll be like a stick, almost like a flat, broad stick that's popped up, pointing like vertically, perpendicular to the keyboard. And you will press the edge of that stick. And if you want to increase the depth, you actually push it down. And it's counterintuitive.
Yeah,
like
right.
Increase down, decrease up. And it's like something as simple as depth. That can be something that's like an initial impression you have. Because generally, if you have any idea what you're doing, once you pop an image onto the screen, the first adjustment is usually depth. And so you go to adjust the depth and you're like, oh, I pressed this way and it went the other way. And then you get a little degree of frustration, and it just sort of like sows the seeds for frustration with the rest of the user interface, even if it's a pretty simple user interface. Like our cart-based equipment at Grace is Zonari, and we opted for like the simple. They had like 2 user interface options. You can choose the complicated one, which is the one I like, or you can choose the simple one. And for all of our systems, I chose the simple one because it's kind of been a guiding principle when you have this like mixed use population of sonographer, like physician sonographers. Just keep it as simple as possible. Like don't let the user interface be the reason that someone won't approach the machine to use it. People are looking for reasons not to approach the machine. Because it's very humbling. And for physicians in training and in their practice, there are very few things that are as humbling as ultrasound, because ultrasound is a visual modality that you can see, the patient can see, everyone in the room can see. And so patients will make these like aside comments all the time. You know, I'll let's say I'm doing a procedure, like I'm tapping a joint or putting an IV in with ultrasound. And I've done thousands of these, right? So I do it fairly quickly. And they'll say like, oh, you're much better than all the other ones that have done that. And then I'm in there teaching somebody and they're struggling, and they'll be like, you're not as good as the people that usually do this. And most of the time the patients don't know how good of a doctor you are. Like they just don't. Like they don't know that you don't know crap about hematology, because you can kind of hide that from them. And the nurses don't know that either, because you can kind of hide it from them. And if you don't know crap about like cardiovascular medicine, well, you can consult a bunch of other specialists and order a bunch of tests, and no one will be none the wiser. But there's no hiding from ultrasound. And so it really like causes these physicians that are approaching it to have this like really honest like moment with the machine and themselves that makes them really uncomfortable. So then they will pick up the machine and they'll use it a little bit, and they're frustrated because it's going really poorly, they're struggling. And then so the next time they start looking for reasons not to use it, right? They start looking for reasons to pursue other means to achieve the diagnosis, right? So maybe that's like, well, we can just do a CT. I know ultrasound's better for cholecystitis, but maybe we could just do a CT, or
And is
what? Let's just consult the cardiologist, because I don't know. I'm not confident in my ability to use this machine.
now, if I can wager a guess, I would say, pushing that off to say a CT scan, or getting the cardiologist involved in that moment also costs more time and money. Time for the patient, and then money for the the hospital or the clinic. Would I have that? Would that be correct?
For the most part, like the more precise and non-invasive your like test methods are, the less associated cost there usually is with it, other than the associated cost of being wrong, right? That's and that's like that's like the omnipresent justification of someone who's not confident in their ability to use ultrasound. It's like, ultimately, I don't want to be wrong, and I don't think I can be right with this, because my experience with it has been difficult to this point. And then so the more unapproachable the equipment seems, the easier it is to justify doing other things and not learning it quickly. And so that's kind of what I mean when I talk about like ultrasound systems and approachability. It's really important to deliver something to these newer users that is approachable, to get rid of the barriers, right? We talk about that when we set up our department and we set up our workflows, is like, you really got to eliminate every barrier that you can to somebody using this. And so the user interface for Kosmos, while not perfect, does eliminate a lot of the barriers to people.